Hello, everybody. My name is Guillem, and I'm happy to welcome you to the second edition of Dr. Vet's training. Today, our invited speaker is Encarna Muñoz, who is an ophthalmologist who works in one of the most prestigious hospitals in Barcelona, which is Arts and Cura, as well as other also very prestigious hospitals in Barcelona and the surrounding areas. So today, Encarna will be talking about the retina, retinopathies, and the nutraceuticals, and which role they can play in this kind of diseases. But just before we begin, let me thank our distributors, who are the ones who made it possible that for us to reach to you, for Encarna to share her knowledge with you. So you can find them here in the sides of my screen to check for which distributor we have in each one of your countries. Also, a quick announcement for those of you who already use our products. You will be happy to know that until now we had Retina, but now we have launched also Retina XL, which is a version for larger dogs that is more suitable to treat these patients. Okay, you can find them in your local distributors. And also just a quick introduction on how the Zoom platform works, just so that there's no problem during the meeting. If you have any kind of issue, you will find an email of Victor, who is our IT manager, in the chat section. So please save this email just in case you have any trouble. You can contact him and he will help you get back in the room again. Also, if you have any questions during Encarna's presentation, you can write them down in the question section, which is at the right of your screen. And at the end of the presentation, I will read them out loud, and Encarna will try to answer all of them live. Okay. Just the last thing for me is that the webinar will be recorded, and we will send this recording to you a few days after today. Okay, and we will subtitle it in English and Spanish, so that it's easier for some of you to understand. Now, that's all for me. Thank you, Encarna. You're very welcome to begin.
Hi, thank you so much for the presentation. Good morning, everyone, and thank you, everybody, for being here today. I would like to thank you to Dr. Vet for inviting me to do this webinar today, to everybody who is here listening. So I hope you will enjoy the lecture, and of course I will be more than happy to answer all your questions at the end of the presentation. Today the topic is about the nutraceutical products and their use on retinal management disease. So during all the presentation I will speak about different publications in human and veterinary medicine regarding these products. There is going to be a lot of human medicine mentions because most of the studies on these products are done for human medicine. And yeah, I hope you will enjoy the lecture. So, okay. So, let's start with the definition of nutraceuticals. The nutraceutical word comes from the combination from nutrients and pharmaceuticals. And basically, they are products coming from food, from natural sources, which have beneficial benefits for the health. We use them for the enhancement of pharmacological treatments, as well as to delay, improve, or prevent some diseases. In this paper from 2022, from the journal Nutrients, you can read a little bit about nutraceuticals and their applications in veterinary ophthalmology. The nutraceuticals can act upon multiple targets simultaneously, but we will focus on their mainly role of antioxidants and neuroprotection. It's very important to speak today about the oxidative stress. Oxidative stress occurs when there is an imbalance between the free radicals and the antioxidants, and they produce cellular damage and inflammation. These free radicals are unstable molecules that can damage cells, proteins, and DNA. And they have a very, very damaging effect on the cells. The role of the antioxidants is to neutralize these free radicals. In this picture, taken from this paper about oxidative stress and its role in retinitis pigmentosa, that is a disease in human medicine, you can see the chemical reactions and how the antioxidants are helping on this. It's very, very important to speak about a specific human disease that is called age-related macular degeneration, because it's very, very connected with the oxidative stress. So there are a lot of studies about the nutraceuticals regarding this disease, and because they are closely linked, I will refer to it during my presentation quite a few times. In this other paper, we can, from 2013, published in the journal Nutrition Research, there is a review of the nutrient actions and the age macular disease. In this figure, they explain the development of age macular disease related to the photochemical damage and the oxidative stress. On the left side, we can see the normal macula, and on the picture, and on the middle and on the right side, we can see the both forms of age-related macular degeneration. There is a dry form where we can see that there is a drusen that is between the choroid and the macula, and it damages the connections, so it leads to the generation of the retinal pigment epithelium and the choroid. And in the wet form of AMD, there is a production of neovascular factors that leads to choroidal neovascularization. In consequence, there is a leakage of fluid, which leads as well to the degeneration of the photoreceptors in the retina and the retinal pigment epithelium. It's very, I'm commenting all of this because the antioxidant products might prevent or delay the progression of this disease, because they can reduce as well the production of neovascular factors. And now I would like to speak about the neuroprotection. Neuroprotection could be defined as the alteration of the neurons or the environment to improve their survival and function. In the eye, in the retina, and in the optic nerve, both of them can suffer from a variety of degenerative disease, which result in a permanent loss of vision. I would like to speak now about the retinal neurons. The retinal neurons are the photoreceptors in the outer retina, that are the rods and cones, and the ganglion cells that are in the inner retina. In some diseases like glaucoma, we can have a loss of function and death of these retinal neurons through different mechanisms, as the oxidative stress, the cytotoxicity, the increase of the intracellular calcium, and the inflammation. I would like to mention this paper from 2021. It was published in the Veterinary Ophthalmology, and basically it's a survey of, they made a survey to 663 certified veterinary ophthalmologists, and they asked them about the use of neuroprotective therapy for this kind of degenerative diseases in the retina and the optic nerve. And the result is the majority of the certified ophthalmologists, they prescribe neuroprotective therapies, at least one in the last 5 years in the patients with this kind of diseases. So it's quite interesting. And now in the next slide, we're gonna speak about the retina. That is our main character today. So the retina is a light-sensitive tissue of the eye. I'm gonna take a phrase from Ron Ofri from the book Slater that I really love, and is that it seems that the entire purpose of the eye is to enable focus light to strictly in a functional retina. I love this phrase, so I have it always with me. So it's a very complex tissue with a very, very high metabolic rates, okay? And it has a lot of similarities to the brain tissue. We need to speak about two very important concepts. First of all, the photoreceptor cells. The photoreceptor cells are the specialized cells in the retina, and they contain photopigments, and they are the responsible of absorbing the light. And the photopigments, they produce chemical energy, and they convert it to electrical energy that later is transmitted to the brain and perceived as the sight. In this image, you can see two pictures taken by retinography. From is the fundus of the eye of a dog, the upper picture, and the lower picture is the fundus of the eye of a cat. These are healthy eye fundus. I would like to mention that every time we do the assessment of the eye fundus, we should put special attention in the optic nerve head that we can see here, the retinal vessels, the tapetal area, that is the shiny area, and the non-tapetal fundus, okay, that is in these pictures down. And now I would like to explain briefly the histology of the retina, where we should know that the retina has 10 layers. 9 of the layers are called the neurosensory retina, and the other layer is the retinal pigment epithelium. It's quite interesting to know that the retinal detachments occurs because of the accumulation of fluid in the space separating the retinal pigment epithelium and the neurosensory retina. And this is because these two layers have different embryologic origins, okay? The first layer is, as we can see in the picture, is the retinal pigment epithelium that is in contact with the choroid, okay? Here is the outermost layer, okay? The second layer is called the visual cell layer or photoreceptor layer, and it contains the inner and the outer segments of the rods and cones that are the photoreceptors, as we explained before. In this layer, in the outer segment of the photoreceptors, is where the visual signs generates, okay? This is very important to know. Then we have an outer limiting layer, okay, where we find the glial Muller cells and the terminal processes. The fourth layer is the outer nuclear layer with the nuclei of the rods and cones. The fifth layer is the outer plexiform layer, where we have the first synaptic layer, and we've got the axonal extension of the photoreceptors. The sixth layer is the inner nuclear layer, where we got the nuclei of the bipolar, amacrine, horizontal, and Muller cells. The seventh layer is the inner plexiform layer, where the second synaptic layer. And we can see here the axons of the bipolar and amacrine cells and the dendrites of the ganglion cells. The eighth layer is the ganglion cell layer, where we can see multiple cell types. And the 9 is the nerve layer, where we see the axons of the ganglion cells. And finally, the 10th layer is the inner limiting membrane that is in contact, is adjacent to the vitreous, and it's a thin hyaline membrane. In this picture, you can see all these layers. It's taken from the book Slater, and everything is very, very well explained. I know it can be a little bit confusing at the beginning, but yeah. And finally, we will speak again about the rods and cones. They've got the photopigments. 2 photopigments I would like to mention. The first is the rhodopsin that is in the rods. That is a vitamin A derivative. And then there is another photopigment that is the melanopsin that we can find in the ganglion cells. And it affects the circadian rhythms, the pupillary light reflexes. We should know as well the process called phototransduction. The phototransduction is the conversion of a visual sign into a neuronal sign, and it takes place in the outer segments of the rods and the cones, where these photopigments are packed into discs, resembling a stack of coins. In the next slide, I will speak about the signs of the retinal disease. People who suffer from retinal diseases often report symptoms such as eye floaters, blurred vision, blind spots, distortions in the vision. As we all know, small animals lack the ability to describe these symptoms. So for us, it's very important to pay attention on the clinical signs that may indicate retinal disease. In small animals, among these clinical signs, we may find bumping into doors or into things, hesitance to go up or downstairs, reluctance to enter in a dark room, dilated pupils, or even cataract formation. Here in this table that I took, I made it, but I took all the information from the book Gelat in veterinary ophthalmology. There are different ways where we can assess the vision in the animals. We can do behavioral testing, for example, doing the obstacle testing, putting some obstacles in a room and checking if the animal can sort these obstacles or bumps into the things. Another test that can be done in the clinic is the visual tracking, where we can use something not noisy, like a cotton ball, for example, to see if the animal can follow this object with the eyes. It is important to check as well the reflexes and the responses, like the Menos response or the pupillary light reflex in both eyes, the direct and the consensual. As well, we should check the fundus of the eye. For this, we can use ophthalmoscopy. There are different types of ophthalmoscopy. The direct, that is probably the one that people in general practice has in their consults. But we can use as well indirect ophthalmoscopy or the panoptic. Another methods are the OCT scan, that is quite sophisticated and is not at the moment very used in veterinary ophthalmologists, but in human it is. And we've got as well the ultrasonography and another test that is called angiography. And we can do as well retinal function testing. The most common is the electroretinography. That is, it is a test made with flashes that can check if the photoreceptors of the retina are working properly. And another test is the visually evoked potentials that is not very used in the practice, but is another test we could perform. So, since most of the publications in nutraceuticals are focused on human medicine, I would like to provide a brief overview of the most common retinal disease in humans. So I will speak mainly about these 3 diseases. The first one, I already mentioned it, is the age-related macular degeneration. There are 2 forms, the non-exudative or dry and the exudative well. wet, and it leads to bilateral blindness. And the etiology is multifactorial, genetic factors and environmental factors. Definitely, oxidative stress plays a role in the development of AMD. Another disease I would like to mention is the retinitis pigmentosa. It's very interesting because it's very similar to the progressive retinal atrophy in our pets. So it's in this disease, there is a progressive and irreversible loss of vision. It starts the same like in the progressive retinal atrophy, with vision loss during dark conditions, and in the end stages, it can lead to day or vision loss with light as well. Of course, the oxidative stress plays a role in the development of the retinitis pigmentosa, as well as inflammatory molecules and other toxic substances. The last disease I would like to mention in humans is the diabetic retinopathy that we have as well in our small animals. During diabetes, retina and capillary cells suffers from oxidative stress, and there is a damage in the mitochondrial DNA. This retinopathy is also considered a low-grade chronic inflammatory disease, as some studies have observed retinal changes that may be consistent with another inflammatory conditions. This is a publication from 2014 in a journal, Nutrition and Metabolism, and well, it speaks about the beneficial effects of the nutritional supplementation in the diabetic retinopathy. And now we will speak about the retinal disease in small animals. I will focus especially on acquired retinal disease that we will divide in two groups: the hereditary and non-hereditary acquired retinal disease. This slide for me is probably the most important because I would like to mention that most of the studies in the use of nutraceuticals in small animals have been performed in these kind of diseases and not in the acute developed diseases that I will mention later. Let's start with the canine multifocal retinopathy. This is a disease that is characterized by distinct multifocal lesions on the retina. It may cause mild vision impairment, but it generally doesn't lead to complete blindness. It occurs because there is a dysfunction in the fluid transport within the retina caused by a genetic mutation. The second disease is the generalized progressive retinal atrophies. And this is very, very common. We will definitely see it a lot in the consult. This is a group of diseases with similar clinical and ophthalmoscopic signs, but they occur because different genetic mutations, and these mutations affects the development or the function of the retinal photoreceptor cells in different ways. It's quite interesting to know that the generalized progressive retinal atrophy can lead to cataract formation. It's a secondary cataract because during this process, there is an accumulation of waste products and proteins within the lens. So we can see cataracts in these animals, but the main problem for their vision loss is the retina and not the cataract. As I mentioned before, it's quite similar to the retinitis pigmentosa, and animals normally start to have vision loss in the low light conditions, leading at the end stages of the disease to vision loss during the daylight as well. And of course, the oxidative stress plays a very big role in this. Finally, I'm gonna speak about the disease called retinal pigment epithelial dystrophy, that it just affects the retinal pigment epithelium, and it's also called central progressive retinal atrophy. This disease doesn't necessarily lead to total blindness. It normally the peripheral vision is maintained. It affects certain breeds, and well, it's been linked to the low serum vitamin E. So the dietary supplementation with this vitamin E, it seems that can arrest the progression but not cure the disease. Let's speak about acquired non-inherited retinal disease in small animals. These are normally conditions that I'm not sure if we should treat with the nutraceuticals, because there's not a lot of studies about them. It includes chorioretinitis, retinal hemorrhage, hypertensive retinopathy, sudden acquired retinal degeneration, and immune-mediated retinitis. Here you can see some pictures. The first picture is it's hypertensive retinopathy with multiple hemorrhages in the retina. The second picture is serous retinal detachment. So, for example, in the case of SARS, the effectiveness of nutraceuticals remains unproven. Some studies have been exploring the antioxidant and nutritional supplements with the hope to protect in the retinal cells or slow down the disease, but there is currently no evidence to the use of nutraceuticals in SARS. But I wanted to mention it, okay? And the next slide speaks about the role of nutraceuticals. Preparing this presentation, I discovered the AREDS, that is the age-related eye disease study. And I found very interesting to mention it in this lecture. This was a major study that was conducted by the National Eye Institute in the United States as part of the National Institute of Health. And it was initiated, this study, in 1992, and it was completed in 2001. And its main goal was to investigate the causes, the progression, and the potential treatments for age-related eye diseases. Of course, putting special attention in age macular retinal disease and in cataracts. So they made a formula of these products, these nutraceutical products, and they studied it. The original formula included antioxidants as vitamins and minerals, okay? Later, there was a second phase of this big age-related eye disease study that was performed from 2006 till 2012, and they were studying in this second edition, like the role of the omega-3 fatty acids that we will see in a little bit, okay? So I found it very interesting. And here I show three papers. There are 3 published articles about the use of nutrients and their effect in the eyes and the degenerative retinal process. And now let's get to talk about the ingredients of the retina. The retina is a nutraceutical made by Dr. Beth, and it's a nutraceutical for the retina. I will focus especially on this product because they invited me to do this talk. So, but however, all these ingredients that I'm gonna mention and explain, they are the ingredients that appears in all the previous papers that we mentioned, as well as they are the ingredients studied in this age-related eye disease study, okay? Let's start speaking about the carotenoids, where we can include the lutein, the zeaxanthin, and the beta-carotene. These carotenoids are found mainly in vegetables, fruits, and egg, and they play a very important role as antioxidants. They have the capacity to produce vitamin A after several enzymatic lavages. But it's to be mentioned that lutein and zeaxanthin do not have vitamin A activity. These carotenoids, especially lutein and zeaxanthin, are found in the lens and in the retina. And they have a very important antioxidant effect because they protect the photoreceptor layer, filtering the blue light. As well, they can deactivate the reactive oxygen species that are very potential oxidants for the eye. Anyway, further analysis have to be done to concrete the use of the lutein and the zeaxanthin for the age macular disease treatment, okay? In the next slide, I've put some publications from various journals in nutrition and human and vet medicine, where we can see studies conducted for carotenoids, of the effects of carotenoids and eye issues, of course, having a very big emphasis in the macular degeneration. Let's talk about fatty acids. The fatty acid is composed by a hydrocarbon and a carboxylic acid group. We can divide them in two groups, the saturated ones that have single bond and the unsaturated ones that have two or more double bonds. Is to mention especially the omega-3 fatty acids that are from the unsaturated ones, and they must be obtained from the diet. These omega-3 fatty acids can be divided in the short and in the long ones. Inside the short, we've got the alpha-linoleic acid, that is the ALA, that is obtained mainly from plants. And in the long, we have the docosahexaenoic acid, the DHA, and the eicosapentaenoic acid, that is the EPA, that they are obtained mainly from the fish. These fatty acids, they've got a very, very important anti-inflammatory effect because they make a competition with the arachidonic acid, and they've got as well a very important neuroprotective effect. They modulate oxidative stress, inflammation, and vascularization. In the next slide, you can see some publications about fatty acids and their different effects in the different retinal diseases. Now let's get to speak about the vitamins. The group of B vitamins, let's start speaking about the V vitamins. The B vitamins are a group of vitamins that play a very, very important role in the cell metabolism. They can reduce as well the homocysteine levels because it's known that the increase in the homocysteine levels is a risk factor for vascular disease. The vitamin B12 or cobalamin is obtained from the animal protein mainly, and it has a very important role in the synthesis of myelin. It has as well an anti-inflammatory function, okay, because it has the ability to modulate the NF-κB, that is the nuclear factor kappa light chain for activated B cells. That is basically an inflammatory, inflammatory factor pathway. So it can modulate this factor. Then we have the vitamins, the vitamin C or ascorbic acid. It can be found in fruits and vegetables, and it's got different functions as inflammatory function, immunomodulatory function, antithrombotic, and antioxidant, among others. I would mention as well the vitamin E, that is in the reality is the 8 fat-soluble antioxidants that have a very, very, very important role as antioxidants, and they prevent the lipid oxidation. They can as well reduce the platelet aggregation and improve the vasodilation. And here I mentioned some of the papers with evidence of the roles of the vitamins in different diseases like diabetic retinopathy, retinitis pigmentosa, and age macular degeneration. To finish with ingredients, we will speak about the minerals, that they play a very, very important antioxidant role as well. The zinc is a very important antioxidant, and it affects the cell proliferation in different ways. It's a very important immunomodulator, and its deficits can lead to inflammation. As well, it has been seen that the deficit in zinc can induce night vision problems, okay? And finally, the copper is another mineral which plays an important role in the oxidoreduction chain and deactivating free radicals. This ingredient was added to this big study, the AREDS study, because it's strongly linked with the zinc levels. Both minerals are very linked, because the high levels of zinc can produce anemia for copper deficiency. As I mentioned before, further studies are required to determine the function of these two minerals in the progression of degenerative retinal disease. In summary, we have reviewed many benefits of nutraceuticals for the eye health, including carotenoids, fatty acids, vitamins, and zinc. The indications for the use of these nutraceutical products is to prevent or to slow down the progression of retinal disease. And this is because they're very, very important antioxidant and neuroprotective effects. On the other hand, there is a lack of published clinical efficiency and the lack of the regulations in the dosage, as well as lack of administration guidelines in veterinary medicines. However, on the other hand, the pharmaceutical companies have rigorously tested these products for their safety, so we can use them in a safety way in our small pets with chronic retinal disease. So this is why these nutraceutical products are widely used in human medicine and in veterinary medicine. This slide, to conclude, here are some pictures taken by electroretinography of some of my patients, where I use retinol as an antioxidant product to help the retina. In all these cases, there is retinal degenerative processes. So yes, I've used retinol in these patients. Signs of retinal degeneration, as you can see here, are hyperreflectivity of the tapetal area. We can see that there is an attenuation of the retinal vasculature. Sometimes there is atrophy of the optic nerve as well, as you can see in the first picture. Here, I also provide a reference on which I base this talk, and among others that you can see that you could see during all the presentation. Thank you very much. These are images of normal retinas, that they are very, very beautiful. And as we can see, they can have multiple variations in the colors. And I would be more than happy to answer any of your questions. This is my cat Nala that I need to show her because I'm sure she would be putting a lot of attention in this webinar. And here I would like to show you 3 pictures. One is a dog retina. The middle one is my mother's retina. That is a human one. And the last one is a cat retina. So it's just to show that the retinas in the small animals are a lot nicer than in humans. So we are very lucky on that. Thank you very much for everybody. And I will be more than happy to answer all your questions.
Thank you, Encarna, for your presentation. We've had quite a lot of feedback. We've got a few questions. Okay. So are you ready? Yeah?
Mm-hmm, I am.
Okay. Then the first one, it says, I'm a general practitioner. In what breeds should I be more careful to refer possible patients?
Well, yes, so definitely, as I mentioned, we are using this nutraceutical product mainly for progressive retinal atrophy. Mm-hmm. So it's very important to know the breeds that are more predisposed to have this kind of problem. For example, the poodles are quite predisposed, but there are a lot of breeds. I would recommend to check the Blue Book, that is a publication that we use in veterinary ophthalmology to check the typical diseases and the congenital diseases and hereditary diseases in animals. So I hope this helps.
Okay, and just a personal question about it. This Blue Book, does it have to be purchased, or is it a list on the internet? How can people find it?
So I'm not quite sure now how to find it because I got it from a very long time ago. But definitely I can later have a look on it and I can email it to you so we can send it to the audience who are interested on it, the link to obtain it. Okay?
Perfect. Thank you very much, Encarna.
You're welcome.
So next question. What is the relation between cataracts and retinal diseases?
Okay, that's a very nice one. So as I mentioned, when we've got a progressive retinal atrophy, the retina, the photoreceptors stop working. And this makes that finally there is a liberation of waste products and proteins in the vitreous that are in contact with the lenses. And this can lead to the secondary cataract formation or toxic cataracts. So it's very, very common that we see in the practice that the animals are referred because of the cataracts, but their main problem in the vision, it wasn't initially because of the cataract, but because of a retinal degeneration. So this is why it's very important when we do cataract surgery to assess properly the retinal function with the test I mentioned before, with the ERG test, because it's very common to find cataracts and retinal degeneration at the same time. So it's something we really have to consider.
Okay, thank you. So it's very important to take into account that the cataract is secondary to the retina pathology.
It can be. There are, of
well,
course,
it may be.
I know there are a lot of reasons why an animal can develop cataracts, but of course, we should have the retinal degeneration in our list of differential diagnoses.
Okay, great.
Okay.
So next question. You explain later that you think nutraceuticals are more likely to work in inherited than in acquired diseases. Why do you think this?
Yes, so I don't think it's that they are more likely to work in inherited than in acquired diseases. I wanted to express that the main role that have been studied in the nutraceutical use is for oxidative stress. Okay, and this process happens in more chronic and progressive diseases in humans and in small animals. So all the studies that I was able to find, they were performed investigating this kind of diseases. So for example, I am not aware about the efficacy or the effects or the benefits to use a nutraceutical product in a acute retinal degeneration, as is SARS, for example, or I am not aware about the beneficial to use nutraceutical products when you have a serous retinal detachment. So it's something we need to consider, that all these publications have been are investigating for chronic progressive retinal diseases.
Okay.
Okay.
Yeah, perfect. Thank you. I hope it was clear for the person who asked the question.
I hope
it was for me. Next, why is the eye more reflective when it has a retinopathy?
So, sorry, can you repeat the question, please?
Yeah. Why is the eye more reflective when it has a retinopathy? I guess, why does the eye glow more?
Yeah, okay, that's a very good one as well.
Yeah.
So the tapetum shows, when, as we saw in the previous pictures, I'm gonna try to go back here. So we can see that there is what we call a tapetal hyperreflectivity, and it's because the retina is atrophied, so it's thinner. So we can see more the reflex that is in the back of the retina coming from the tapetum.
Okay.
So that's why when we have a thin retina, we can see more reflectivity from the tapetum. Okay?
It makes sense. Okay.
Okay.
Okay, we are almost there. We have 2 more questions.
Okay.
Next one is, if I suspect of any retinal disease in a generalistic clinic, should I start using nutraceuticals before the ophthalmologist sees the animal, or should I wait?
So, as I mentioned before, to use a nutraceutical product is a very safe option. I wouldn't start to use a nutraceutical product without the ophthalmologist sees the pet. Is not going to make anything, but it's very important that the ophthalmologist can see this patient. Nutraceutical product is going to help in case that we have some degenerative conditions. So it's not a problem if we start to use this product, but we cannot just lead everything on this. We need to really refer this patient. But where is an option you can start to use the nutraceutical, it's not going to make any damage definitely to the animal. Okay.
I guess then you would wait just to make sure that the client gets the animal to the ophthalmologist, and
well,
stay just with the treatment.
It depends of it depends on what I'm suspecting. If the first opinion vet it has a high suspicious that this animal can have like a degenerative retinal disease, I would definitely start to use the product and then refer. I don't think there is any problem giving the product before, but ideally we should make a diagnosis and then we can start to choose the therapy.
Okay, great. And the last question is from a very polite person who says thank you, Encarna.
Okay, yeah.
What fundus camera do you use or recommend?
So these pictures I taken for with the Aurora from Optomed. And this is the one I use, and I really like it.
Aurora from Optomed. Okay.
Yeah, it's called Aurora, and and it's from Optomed. So it really makes very good pictures. This is true.
Okay.
So,
perfect.
This is the one I use. Okay.
Yeah, great. Thank you, Encarna. So remember, all of you, that if you missed any part of the presentation, or for instance, if you already forgot that this camera is from Aurora, then you can watch the video that we will post on YouTube, and we will send this link to you in a few weeks. Okay. So that's all for us. Anything else, Encarna?
No, thank you to
Yeah.
everybody for their time and listening, and I hope they enjoy the presentation.
Thank you. I think it was very clear, even for me, who I'm not an ophthalmologist. Yeah, everything was very clear to understand. So
Okay, thank you
very
so
much,
much.
Encarna. Okay, bye everybody. See you in a few weeks in the next webinar. Okay, we will announce it when we have a date. Okay, so bye
Bye.
everyone.
Bye.